So my name's Alison Farmer. I'm a psycho-oncology nurse specialist at Southampton General Hospital. I've been looking at the psychological aspects of cancer for about 30 years, and you are the first people I've met with ocular melanoma. So an indication of how rare it is, and I've learned quite a lot about it since I was asked to speak to you today. It is quite an emotional subject, talking about the psychological impact. If anybody would like to catch me afterwards for a chat, I will stay around for a bit, but some emotions might be triggered. So I've studied psychological aspects for a long time. I then went back to nursing and work seeing inpatients at the hospital, but I should also tell you that I've had work experience, having had ovarian cancer 16 years ago this month. So I do have some experience of the impact of diagnosis, treatment, and chemotherapy. So imagine you're lying on a beautiful beach, reading a book in the sun, enjoying yourself, life is good, everything's going along smoothly, and suddenly you're hit by the most enormous wave that comes completely out of the blue. You're thrown into the sea, you're tumbling around, you don't know whether to swim up or down, you're struggling to breathe, exhausted, trying to get to the surface. Every time you get near the surface, you're thrown down again, and eventually you find yourself washed up on the beach. You are exhausted, you're bruised, you're battered, and it takes you a while actually to get up again. And I think that is similar to being diagnosed with cancer. It hits you like a wave, the rug is pulled from under your feet. You wouldn't expect after that period in the sea, struggling, fighting, having all these ghastly treatments, to just be able to get up and walk again. You need some time to actually recover from that experience. Cancer could be thought of as the Voldemort of diseases, particularly several years ago, certainly when I started doing research in the 80s, a lot of the doctors I worked with wouldn't actually use the word cancer. So it was the disease that shall not be named. Things have improved now as far as that is concerned, thanks to the media, thanks to soap operas, thanks to magazines. There's a lot more talk about cancer, but it still strikes fear into the heart of people who are diagnosed. We've come a long way as far as treatments are concerned since Hippocrates described cancer in 400 BC, since this 13th century wood carving of a monk examining a woman with breast cancer and appearing to chastise her for developing the disease. And that was a common theme. Women were thought of as too hysterical, too melancholy, too nervous. And we've now come as far as the new immunotherapy treatments that Ian alluded to. This is the centre in Southampton that will hopefully be opening shortly. And so treatments have come a huge distance, particularly in the last few decades. So how might cancer affect you emotionally? If this was 1970, we wouldn't be talking about this because doctors were actively discouraged from asking patients anything that might upset them. So they would avoid the topic. And it was in the 70s that a group of psychologists, psychiatrists, doctors and nurses got together and started the British Psychosocial Oncology Society that's still run today. And they are responsible for amazing work looking at the psychological impact of cancer. And we know so much more about it. And we are aware that it's about quality of life as well as quantity of life. Oops, what happened there? Sorry, just jumped out. So let's start with the diagnosis of cancer. Ask anyone who's been diagnosed with cancer and they will tell you where, when and how it happened and probably what the doctor was wearing. It's known as a flashbulb memory, like remembering where you were on 9/11 or when Princess Diana died. It's a very traumatic episode, and we do know that the way the diagnosis is given to you does affect adjustment to the disease. What are the main psychological responses to diagnosis? We know that 50% of people have some form of anxiety and depression who are diagnosed with cancer. This is all cancers. And about 30% of people would benefit from some form of either talking therapy and/or medication. So it's known as a clinical anxiety and depression. Now, when I'm referred patients at the hospital to see who are really struggling, what I'm aware of is what's normal. When you're diagnosed with cancer, it's normal to experience shock, disbelief, panic occasionally. Panic attacks are far more common in cancer than I ever realised since I've been doing this job. And distress. That panic and distress tends to be self-limiting and resolves over days to weeks, with support from family and friends usually. So it's recurrent overwhelming emotions which pass. So those waves that keep hitting you occasionally, that's normal. When we we become a little bit concerned when symptoms become a problem. So if the symptoms don't improve after a few weeks, if there's a persistent low mood for more than 3 weeks, a sense of loss, hopelessness, or if a patient says that they're suicidal. And again, that's not, sadly, those suicidal thoughts are not unusual after a diagnosis of cancer. So sometimes I have to say to the nurses, thank you for the referral, but actually this patient has understandable distress. And my main job there is to listen to the patient, to validate their feelings and to hold that distress. And that's often enough. So we've looked at anxiety and depression. Would anyone like to say just one word, what other feelings or emotions went through your head when you had the diagnosis? Sad, yeah. Anger, very good. Disbelief? Lonely, yeah. Yeah, all of those things. So you just absolutely hit the nail on the head. Anger, of course you're angry. You have a right to be angry. We get angry about this disease. And anger, we have patients on the ward and the nurses will struggle to deal with patients who are angry. And sometimes they're labelled that nuisance inside room 1. And I have to remind them that that patient inside room 1 is dealing with this disease, dealing with the treatment, self-employed, young children at home, all the other aspects that come in. And often male, funnily enough, that gender script kicks in, that struggling to show his emotions. And actually, I like to keep in the back of my head that there's no anger without fear. And if you respond with empathy, quite often the patient will cry. So anger is very, very real. Fear. Post-traumatic stress disorder, a small percentage of patients will struggle with intrusive thoughts and flashbacks about the diagnosis. Some people can't concentrate. Uncertainty, isolation. Somebody said feeling lonely. Feeling isolated, even if surrounded by people, is very common after a diagnosis of cancer. And loss, and we'll talk a little bit more about loss in a bit. So during treatment, you've had the diagnosis, then often have to go through some pretty grueling treatments. Side effects, fatigue. Cancer-related fatigue is not normal tiredness, it's the inability to get up and make a cup of tea. Cognitive impairment after chemotherapy can be frustrating if you bump into your neighbour and you can't remember their name. And that isolation, real or perceived. Loss of well-being, independence, role, social status, and very importantly, control. I think many patients struggle with that loss of control because suddenly they're whisked into hospital, they're given a regime of treatments and drugs and appointments, and gaining back that sense of control a little bit can really help with maybe being involved with treatment choices. Some people choose to change their diet, to exercise, to actively cope in that way to gain a bit more control. And then after treatment, that sense of vulnerability. The world is not a safe place anymore. Did I have cancer or do I have cancer? Many patients ask themselves. And loss of confidence. And I think it doesn't matter who you are. You could be a captain of industry or someone working in a garage, whatever. That loss of confidence can be, is very often there. And you might think at the end of the treatment, I'm going to have a huge party or I'm going to book a holiday. But in fact, can make you feel quite vulnerable when you're discharged from the hospital. You want to sort of stay close. So just give yourself time. Living with uncertainty, again, we'll cover a bit more. And the expectations of other people. How many of you have heard some of these? Hands up, somebody said one of these things to them. Yeah. All of them. All of them. If when I go to see patients, so many say, if one more person tells me to be positive, I am going to thump them. You can fight this. Most people with cancer absolutely hate that. They don't want to be fighting with their bodies all the time. And I heard a lovely saying at a conference I went to a while ago, when a patient said that he had, rather than fight his cancer, was dancing with his cancer. Sometimes he would take the lead, sometimes the cancer would take the lead, but he was going to dance until the music stopped. I thought that was a nicer way of looking at it. Forget about all this, put it behind you, from work colleagues often. You look great. See, you're back to normal. It's often the time you actually feel the worst, the most vulnerable, the most worried. Really helpful. My friend's sister's mother's aunt died from that cancer. And you've had a good life. That was actually said to me when I was diagnosed at 40. And I thought, yeah, I have had a good life, but I would quite like another 40 years. And you might be surprised to hear that was my lovely late father who said that. And we laughed about it afterwards, but it was a great illustration of how difficult it is for family and friends to talk to somebody who's got cancer. So let's look at the impact on family. I imagine there's quite a lot of family members here. Family members can be known as second-order patients. Anxiety levels can be higher in family members than those of the patient. They're dealing with changed roles. They may have health issues themselves. They may experience depression. Living with somebody with depression is actually catching. So there's one reason to get depression treated, because other people can become depressed. Expectations of yourself, usually too high. Most relationships do remain strong when someone's diagnosed with cancer and can get even stronger than they were before. But occasionally, if the cancer is diagnosed during a difficult stage in the relationship, maybe you were even considering divorce, then the cancer isn't really going to help, and it's not always about the Waltons. And George Burns said, happiness is having a large, loving, caring family in another city. So when we're talking to our partners about cancer, they're highly anxious, they may be caring for you. Some of the communication traps that occur are, the strong emotions around all this. Some people can't find the right words to talk about it. Some patients don't want to show that they're not coping, don't want to burden the partner with emotions and thoughts and sadness. Or different coping styles. So some patients will say, I really want to find out all the information. I want to know everything there is about my cancer. But my wife is just pretending it's not happening. She's in complete denial. She won't look anything up. That's a very common communication trap. And wanting to protect each other. The cancer becomes the elephant in the room. I saw a woman last week in the hospital, 39. She was avoiding her partner, avoiding her sister, because they were both pushing and pushing her to get out, walk to the post office, do this, do that. She was very unwell. She didn't feel she could say, I'm really unwell, because she was protecting them. They felt they were helping her, and it was just causing this huge chasm between them. What can help? Most importantly, keep talking. Schedule a time to talk about cancer feelings and set a time limit. So you might say, right, we're going to talk about it for half an hour at 6 o'clock. Avoid interruptions. Practice what to say if it's difficult and write it down if necessary. And avoid labelling. We always do that with our partners, don't we? You always do that. It's not helpful, and it will make someone immediately feel quite defensive. Just going to talk a little bit about sex, because it's something that is often not discussed. And you might think, oh, it's ocular melanoma. Why is that going to affect my sex life? But in fact, the evidence suggests that it doesn't matter what cancer you have, 30% of people will struggle with their intimate relationships afterwards. And this is a lovely quote from, I went to a talk by an oncosexologist, and there really is a person, he's in Holland, not England, unfortunately, and this is something that one of his patients said to him, and I think that is, just hits the nail on the head, really. It's again, something that is rarely talked about. We know that cancer can affect intimate relationships, sex life, and self-image. There's often an assumption that sex isn't important in the face of serious illness, and a misconception that older people are not sexually active. I was put in my place when interviewing a 74-year-old lady with breast cancer for my research, and she said, the worst thing for me about losing my breast is that I've just got a new boyfriend. So that was a bit of a lesson to me. We know that sex and intimacy is beneficial physically and emotionally. It's great pain relief. It's the safest sleep medication. Oxytocin levels increase, so you become, mutual trust is improved. So lots of advantages. But the potential problems are impact of surgery, emotionally and physically. Maybe medically induced menopause for some people. Stress. Tiredness, just want a cup of cocoa. Even if George Clooney walked in the room, you wouldn't be interested. Unrealistic expectations, and a change in relationship dynamic. If somebody becomes your carer, that can be quite tricky, can make relationships feel a little bit awkward in that situation. You go from adult to maybe parent-child, so that can impact. Your partner might be afraid to hurt you. So lots of potential problems. What can help is talking to your GP or oncology team. You know, as in a recent study with women with gynecological cancer, 62% of them said their doctors had never mentioned sex. Absolutely shocking. So unfortunately, it's often down to the patient to mention it if it's an issue. Talk to your partner. Don't rush things. Scheduling quality of time and relaxation, and maintain that intimacy, cuddles, touch and kisses. I'm on the ward where I work, we have patients who are in for very long times, often having treatment, and we will put notices on the side room door, do not disturb. We will let the partner just get into bed for a cuddle. All that thing is really important. We have to remember as nurses that patients still do have lives outside the hospital, relationships, and that's really important to keep that going. Now, what about friendships? How many of you found your best friend cross the road to avoid you, or didn't ring for ages? Did anyone have issues like that? Yeah. It's sadly very common. It can be very hurtful. We expect a lot from our best friends, and sometimes they've disappeared. We know that social support is important. It's associated with psychological adjustment and enhanced quality of life. And misunderstandings are really common. Some friends can't cope with the distress. Some friends are made aware of their own vulnerability to the disease. Some friends might have had a really bad experience looking after a relative with cancer. A number of reasons that they disappear. Sadly, friends can become less supportive over time. Initially at diagnosis, the house might look like the Eden Project, full of flowers. And then as time goes on, particularly if cancer recurs, then that support can be less, sadly. But on the good side, other people come out of the woodwork. Acquaintances become great friends. People leave food on the doorstep when you have chemo that you didn't expect. So things like that can happen. And support might be rejected, that unrelenting optimism. We'll be fine, come on, let's go out and party. And, what we really need is a friend to be there and listen and be aware of what mood we're in at the time and be able to adapt to that. Living with uncertainty, anyone diagnosed with cancer, whatever the stage, whatever the type, will say that there is that underlying fear of recurrence, fear of the future. And it does get better over time, there's no doubt about that, but even 16 years on, if I have a twinge, it's the first thing I think about, even though most of the time I've completely forgotten I've ever had it. What we do know that worrying about things we can't do anything about doesn't prevent disaster, it prevents joy. So what can we do to help with worry? Some people have worry-free zones, so they might make a certain chair somewhere that they're not allowed to worry in, or a certain room, or they're not allowed to worry in bed. Now that's easier said than done because I'm sure we've all woken up at 4 a.m. full of worry. But actually, rather than lie there worrying, the advice is to get up and do something and go back to bed when you're tired. So identify those worries you can do something about and those that you can't. This is the worry tree. It's probably a bit small for you to see. But if it's something we can't do something about, then let the worry go or box it and change the focus of attention. Sometimes you might need to get that worry out of the box. That's fine, but it can be done with practice. If it's something we're worrying about that we can do something about, then make an action plan. Either do it now, let the worry go, change the focus of attention, or schedule it in for later. So there are ways to manage worry. Unhelpful thoughts. Again, we often have unhelpful thoughts when diagnosed with cancer, and it's important to remember thoughts are just thoughts, not facts. Some thoughts are unhelpful. Think to yourself, how are these thoughts affecting my emotions, physical sensations, and behaviour? We can turn down the volume of our thoughts by looking for evidence for and against. And sometimes it's as simple as a piece of paper with 2 columns. What's the evidence for this thought? What's the evidence against this thought? So I recently saw a partner of a patient at the hospice where I work who was telling me she was a really bad wife because at 4 a.m, when he was constantly repeating her name, she got irritated with him. So she felt that made her a bad wife. So we looked at evidence for and against that thought. She had been there with him constantly for 7 weeks. She washed him, she fed him, she did absolutely everything for him. There was so much evidence that she was a great wife. So just simple things like that can actually really help. So challenging your thoughts. What's going through my mind? Is this thought helping me cope? How does it affect me? Could there be another way of looking at this? And a great question, what would I say to my best friend? And just coming to the end now, if before your cancer you had an allotment, you were a fantastic gardener, you were an Olympic rider, whatever, if you can no longer do those things that you used to do, there are alternatives. Think about what values did you gain from those things you used to do. Did you enjoy gardening for being outside, being in the sun, the pleasure of watching something grow? Think about how that can be downscaled. So looking at the values in things that we did is really important. So in an ideal world, screening for distress should be routine. There should be health education specific to ocular melanoma. I'm sure this charity does, and from what I've seen so far, an amazing job in not only getting you together, but getting the information and putting on conferences like this. Take all the support you can get. And remember, many factors make a difference to adjustment. So the most important message is to be kind to yourself. When we're diagnosed with cancer, we have emotional, social, personal, background things all coming in at the same time. We all come to it with baggage. So there's no right or wrong answers, but hopefully there's a few things to think about that might help. And those are some of the supports and links. So thank you very much. Any questions?